why is tretinoin a prescription and the other ones aren't if they're just going to turn into tretinoin once they're on your skin?
I don't think that it would be beneficial for really anyone at this point to change those to be drugs.
What is the saying?
You can't put the genie back in the bottle.
Exactly.
Yeah.
Cat's out of the bag.
Cat's out of the bag. Yeah.
Who put the cat in a bag to begin with?
They don't belong in bags. Actually, the cat probably put itself in the bag.
That's true.
You ever met a cat?
The cat does get its head stuck in the bag.
Yes. The cat is going to fit itself into the bag like fully. It's going to find a way.
And then when it can't figure out how to get out, it's going to freak out.
It's going to get pissed at you. Yeah, for letting it get
Don't
in the
come
bag.
near it.
No.
And the cat's out, it's not going back in.
Girl, speak for yourself.
Hello, everybody, and welcome back to another episode of Beauty by the Beaker. I'm Natalie.
And I'm Sadie.
And we are cosmetic chemists.
And we are here to give science a hot new makeover.
We're going to do it.
We are.
And it's going to be hot.
Today's I don't know. Is it going to be a lukewarm makeover today?
Today's more of just like a conversation. I wanted to do a little episode just about the difficulties of finding efficacious skincare in the modern market.
Yeah.
Because it's tricky.
Yeah. I feel like after the heels of PDRN and then our retinoid episode, we kind of realized we talk about the difference between drugs and cosmetics all the time, but we haven't really dove into it. And so I think it's important to talk about that and also talk about why it's so damn hard to find products that are legitimate in today's day and age.
Yes. In our past couple episodes, I feel like we've talked a lot about ingredients that have some they're trending in an interesting direction, but aren't, there's not enough to like make really sure claims on them.
Yeah. Because
we've been talking about a lot of those types of ingredients, we just kind of wanted to spend a little more time on that portion of the conversation, which is why are some drugs OTC and some cosmetic ingredients are not OTC, but they still work.
And if you think that sounds boring, you're wrong.
It's
okay.
Not.
There's actually a lot going on here, a lot of nuance, and a lot we can talk about.
Yeah. I wanted to start this conversation because in a few episodes back, when we talked about PDRN, was it PDRN or was it the acne episode?
We also talked about Alex Earl's skincare line and how some of...
Maybe that's what I'm thinking of.
Yeah, I forgot about that. We also talked about that and how they're making a lot of OTC adjacent claims.
Yes.
And that was a big issue we had.
Yeah, we talked about that like with Reale Actives, like how they make a lot of claims that are very similar to drug claims. In that episode, we were very much like, this is a little bit haphazard the way you're making these claims.
Yeah.
Today, we're going to kind of look at the other side of that and why it's a little bit more advantageous for a brand to maybe go in that direction instead of trying to pass an ingredient with the FDA.
Yeah. I'm also going to see how many times I can say the term loosey-goosey in this episode.
There were a couple loosey-gooseys in the last one.
There were, and every time I said it, I was like, girl, can you not find one better term? So I'm just getting loosey-goosey with my vernacular.
Have you met any tight geese?
Girl, don't ask me that. Actually, though, there was a duck on my driveway this morning.
A duck?
There were two ducks, a boy and a girl. I don't have a body of water anywhere near my home.
Well,
so I don't know what they're doing.
That is crazy.
Yeah.
Yeah, we mentioned, I think it was in the Reale Actives episode, we mentioned that a drug is defined as anything that changes the structure or function of your skin. But that definition was made a very long time ago, before modern scientists had figured out that basically everything, to some extent, does change the structure and function of your skin, at least for a little while.
Yeah.
Like your skin functions and looks different when it's in the water versus when it's not in the water. But that doesn't necessarily make water a drug.
Yeah. That definition I've actually struggled with kind of over the course of my career because it's like, what is structure or function? I think that's something that's not super obvious. Currently, the FDA's definition would be things like hair growth, sweating.
I think maybe a more specific way to define it is that the ingredient itself that is being marketed as the active ingredient, the drug, is more I think it maybe has to do with bioavailability. Like in our episode last week, we talked about how retinoids kind of bind with retinoic acid receptors, and that starts a chain of events. I wonder if it has to do a little bit more with that it's like binding with something and then another process is happening.
Yeah.
A more well-studied pathway. Yeah, like we kind of said, it's an older definition and it's not really that accurate, and there's not really a good way to define it because it's just not, I don't know, it's not a very good definition.
Yeah. And like with our retinoid example, so the OTC version is adapalene. And that one facilitates skin cell turnover, but so do the other cosmetic ingredients. They just do it in a different way.
Yeah.
And so, yeah, to your point with like maybe the mechanism or the binding, like it could just have something to do with that because those are not, well, I don't know, but then does it have to do more with like following the monograph?
Yeah. So... yeah, this is why
we get confused with it. It's it's like, I don't know. It's very complex.
Yeah, I think that's why it's so hard as a consumer is because even the people making these products are not like fully aware of what chain of events took place to get us to our modern day regulations and like why certain things are the way that they are. So we've made some assumptions about like why certain things are regulated as drugs and why they go the cosmetic route. Why certain ingredients are the way that they are now doesn't always make a lot of sense. But moving forward with new ingredients, there might be some pretty big reasons that a company decides not to pursue drug claims with an ingredient. And that's more of what I wanted to focus on for today's episode. Less about like the history of the ingredient regulation, but more about how now it can make it a little bit tricky because of the rules that have been put in place for drugs. It makes it trickier to determine what actually works in skincare. I think a good reminder maybe that, I mean, we remind you on every episode, but the things that you ingest and that go inside of your body don't work the same way as things that are topical. And I think sometimes as cosmetic chemists, I forget that it's not just topical OTCs.
Same.
And like topical prescriptions. I forget that most drugs are ingested.
Yes.
So that is why it gets really tricky, is because we really shouldn't be crossing over that data as much as we do. Ingested data or injected data and topical data.
Yep.
But that's usually where the idea starts. It usually starts with something being ingested, and then we use that to determine, could it be topical? Like PDRN.
Yeah, I was just going to say.
Yeah. Like not necessarily ingested, but that one was injected or put on broken skin. And then those results were used as evidence that it's going to work topically, which that's not a through line.
Yep.
Having some topical things be in the same category almost as oral drugs, I think does make it a little bit harder for topicals to make strong claims without, like, I don't know, topicals can't make the same claims that an oral drug can make.
Yeah. Or at least they shouldn't.
Yes.
A lot of companies get loosey-goosey.
They do.
With that crossover.
Yeah. But that crossover also does sort of have to happen because it's like the natural way of scientific progression, I guess. Like you notice something and then you apply that observation to another situation. And I think that's what's happened a lot in skincare, is that we've seen drugs that work, so then we try to apply them to a topical method.
Yeah.
But I have to imagine that at least in the US, with like the FDA being a newer thing, relatively, I guess.
Yeah.
more relative than people have been using skincare, that's for sure.
Yeah. Wasn't it 1903?
Yeah, that was the first iteration of it.
Not me not knowing my history, even though I've done several episodes on that. Yeah, the FDA is a relatively new regulatory body.
Yeah, and things have been changing with it. New things have been passed, you know? And now I think modern cosmetic companies have to sort of, like if you are developing a new skincare active and you see really great results, it would be much more difficult to have that active become a drug than it would be to just show anecdotal evidence and try to pass it off as more robust scientific evidence.
Yeah.
So that's also where I think some of the bad science in skincare comes in, is because usually with skincare, people care more about the anecdotal evidence than they do anything else.
Yeah.
And yeah, it can be hard to tell like what's actually doing the heavy lifting in a topical product.
Yeah, because they're so complex.
Yeah.
Yeah, I agree. I think my issue is not with companies going from injectable or oral to topical, because like you said, that's a very natural through line. I think my issue comes with the claims that companies make and how I feel like a lot of ingredients have over-claiming that kind of happens.
Yeah.
But I also understand that there's not necessarily motivation for companies to do super rigorous testing and spend a bunch of money to test their ingredients to get really good scientific data. Because also they're still companies. They need to make money. And so I don't know, maybe doing a smaller scale study and then saying like, well, this has good results, so we're going to market it. It's a good business decision.
Yeah.
And that's not to say that it doesn't work.
Yeah.
So I think like I see both sides of it.
Yeah. Yeah. And I think with like skincare ingredients, it's much easier to get anecdotal evidence first and then provide better testing that can prove that ingredient to be efficacious.
Yep.
The goal is that if something is proven to be efficacious, that it would be a drug that is regulated by the FDA. But if something doesn't follow the pathway where it is rigorously tested before it goes out to the market, then you can't really like prove after the fact with the scientific evidence that it works and then revert its status from an OTC active to a prescription or cosmetic to an OTC. That process is a lot harder to do. I feel like PDRN, because we talked about this recently and because it's a hot topic right now, is kind of a good example of this situation where there is some interesting data on PDRN for drug applications.
Yep.
But now that it is being distributed as a cosmetic ingredient, once people believe something works, they don't need to see evidence of it anymore. So you don't really need to convince people that already are on board.
Yeah.
And if you're already on board with PDRN working, then you're not holding out for the scientific evidence to show that it works. And by the time that evidence might come around, there will be so many other people that are already using it because they didn't care about the evidence to begin with.
Yeah.
And at that point, you can't just say like, oh, well, we proved that it works. So now none of the brands that are using it can use it anymore because it's an OTC active. Or like the FDA is going to regulate it now. So sorry, all of these formulas that are already made and all these products that are already out there, but you're now drugs.
Yeah.
Like that just can't happen.
Yeah. And I don't think it should happen.
No.
I don't think that every ingredient should be FDA regulated. Like that would be so annoying.
Right.
It would be so expensive. And I think it would take away a lot of the creativity that companies are allowed to have with their products. So yeah, I don't want anyone to think we're like pro FDA regulating every ingredient because that's not the case. Like there are ingredients, we kind of talked about this in our Reale Actives episode, but there are ingredients like mandelic acid, azelaic acid that are great for acne. They're, very efficacious and there's so much anecdotal evidence to show that those ingredients are good for acne. I don't think that making those regulated by the FDA
What do you have to say about that?
Here's what I'm going to have to say about FTC. FDA. What the hell? I just had a stroke. Okay. I don't think that it would be beneficial for really anyone at this point to change those to be drugs.
Yeah.
Like you were saying. Like,
yeah.
I just don't think that helps. I think if an ingredient is going to be regulated as a drug, I think it needs to be introduced to the market as a drug.
Yeah.
Rather than like changing things that are already on the market and already popularly used to become drugs later.
Yeah. I feel like you can't really, what is the saying?
You can't put the genie back in the bottle.
Exactly.
Yeah.
Cat's out of the bag.
Cat's out of the bag. Yeah.
Who put the cat in a bag to begin with?
They don't belong in bags. Actually, the cat probably put itself in the bag.
That's true.
You ever met a cat?
The cat does get its head stuck in the bag.
Yes. The cat is going to fit itself into the bag like fully. It's going to find a way.
And then when it can't figure out how to get out, it's going to freak out.
It's going to get pissed at you. Yeah, for letting it get
Don't
in the
come
bag.
near it.
No.
When the cat's out, it's not going back in.
Girl, speak for yourself. But that being said, I do not condone companies using language that is regulated by the FDA and terminology that is regulated by the FDA. That's where the difference is.
Yes. Yeah, I think that this one is just such a hard one. Because, I agree with that. But then it's also like going back to the mandelic acid thing. It's very hard to talk about mandelic acid as an acne ingredient without getting close to the FDA's realm.
Yeah.
But it still has potential to work in that way, just less data.
Yeah.
I think it's hard because in an ideal world, brands would just be super transparent about like, this works for acne that we think so.
Yeah.
The government doesn't yet, but we have seen improvements.
Yeah.
And it's not really a drug, so this is all just kind of anecdotal and like it might not work for you. It might be that we had a completely different environment and everything, but like it worked for us for this, so give it a go.
Yeah.
But like that can't happen.
Or like if the FDA somehow signed off on each individual brand that launched or product that launched and was like, oh, yeah, like that has, this one has good data, like you can use acne terminology, which it's just, that would never happen because it just opens up so many other doors. And it's hard because I think that terminology should be regulated. Things like anti-dandruff or hair growth, or like, I think that stuff should be regulated because what happens if it's not? Then like, should it just be a free for all? Should brands be able to say whatever they want to about their products?
Yeah.
Like, I don't think so.
Yeah. I'm never not going to defend doing studies.
Right.
Scientific testing in general. Yes. I think more tests are great.
Yeah.
Something that I kind of hadn't really thought about with topicals is that some of these ingredients that are FDA regulated, like the instructions will say like where it's supposed to be used and like how frequently you're supposed to use it. And those types of directions are actually important for exposure.
Yes.
So like some of the retinoid ingredients are not approved for use on your full body because it's too big of a surface area to be exposing to that much of the active ingredient. Right. But they are approved for use on your face because your face is a relatively small surface area compared to your whole body. But because these ingredients are able to interact with your cells.
Owen?
Owen Spalding. You don't podcast.
You don't have a microphone for a reason.
Yeah. Your voice is bad for podcasting.
You don't even have a BXB account.
Seriously. I keep looking at my notes like I have them.
You're on the YouTube homepage again?
Yeah. One other thing with like testing is once a skincare company makes a formula with an ingredient in it, we have mentioned before that individual ingredients are not nearly as important as the formula they are made into. And if an individual company is putting together a formula, it would be much better for them to do testing on their formula so they can show how beneficial their product is. Yep. If they're doing testing on just general ingredients, that benefits everybody who gets that ingredient. And that's not necessarily a great way to make money.
Well, and it can change. So even if we do rigorous testing on one ingredient, it can change completely depending on the product it's in.
Exactly. So it matters that they do it in their product as well.
Yep.
But yeah, you'll kind of get this like one-sided testing because brands are testing their own products. And I'm not against brands running tests on their products, but like that's kind of what we saw in the Reale Actives. They ran some sort of test.
Yeah.
And people saw results.
Yeah.
Undisclosed.
Visible results.
Visible results were seen in some way.
Yeah. Results that they couldn't even really describe because it would be crossing over into drug territory.
Right. And that's like the hard thing. It's like, that doesn't mean that their entire test is bogus.
Yeah.
There could be some good information in there, but it's hard because we are relying on the company selling us the product to give us good information about their product. And they're not really going to be comparing it to like other efficacious products of the same nature.
Yep.
If a company is testing a product, they are going to test it against whatever makes their product look the best.
Exactly.
So a lot of the times those are tested against like nothing.
Yeah.
Where it's like, oh yeah, it was way better than if you just don't do anything. If you neglect your skin for 1 month, it's actually worse than if you use our product every day.
Yeah.
Like that's what a lot of this data is. But is that still better than nothing? Probably.
Yeah.
Probably. It's something.
Yeah. Well, and we always call for double-blind placebo studies because that's like the best, the most accurate way you can get a study.
Also, I want to just quickly, double-blind placebo, if you don't know, it just means that there are two groups. There's a group that gets the drug. There's a group that gets a placebo drug. And the double-blind part means that neither the people receiving the drug or the people testing the results know who is who.
Yep.
So both are blind to what drug was given where. And this is supposed to cut down on biases so that people don't say like, okay, now I'm testing the group that got the drug and, oh, I do see that like things are way better.
Yeah.
You know, you're testing it kind of randomly and you don't know who got a placebo and who got the drug and they don't know. So that's what that means.
Yes. Which is great. Yeah.
I don't think we've ever really.
Yeah, I don't think we've described it. Well, and the placebo part is really important because a good placebo will be the same exact formula without whatever ingredient they're testing. So if you are testing a moisturizer with PDRN, the correct way to do that would be to test the same exact moisturizer with PDRN and without. The only difference is that one ingredient, the PDRN. That is the correct way to do a placebo study. That's not always how brands will test it because, like Nat said, that might not give them the best results.
Yeah.
Because that's the best way for you as a consumer to know if the PDRN or whatever ingredient is being used actually works. If there's a visible difference in the one that does have that ingredient, that's a good way for us to know, okay, this actually does make a difference.
Yeah.
But those results might not be impressive. They might not even really be there. A company might find out that this ingredient that they have been spending time and money on doesn't actually make a difference. So sometimes it's in their best interest to do a badly done study because it will show more impressive results.
Yeah.
And that's not me saying any brands are doing that. I'm just saying like that can happen.
Yeah. So this is part 2 to our retinoid conversation because retinoids that are available to you fall into all sorts of different categories from drug to non-drug. So we wanted to talk a little bit about why things are confusing because retinoids are certainly no exception to the confusion.
They're almost the rule.
Yeah, seriously. When picking a retinoid, it can be very tempting to think that higher strength or the more bioavailable version is going to be the most effective. And like we mentioned last week, that's not always a great blanket statement because if you're getting too much of the retinoic acid, you can have some negative effects.
Yep.
So
maybe this would be a good time to say if you hear wind in the background, we apologize.
Yeah. The cameras are overheating.
Yeah.
And we need this airflow, unfortunately.
We do. So, but you're probably going to hear it. So
my biggest pet peeve is when people say, oh, if you can hear construction happening in the background, sorry. And you can't hear it.
No.
You can never hear it.
No. Also, here's what I have to say about that. Did you not edit the whole episode and listen to the whole episode?
Why'd you leave that
there
in?
wasn't construction noise?
I know.
Whatever.
I
mean, I can't say because I don't edit anything, but I'm glad you agree.
Oh, thank you.
As the editor.
Yeah, so we wanted to talk about a little bit of history, I guess, on how drugs can kind of work in the US. Also, tretinoin, which is retinoic acid, has been approved for use in the US for quite a long time.
Mm-hmm.
Basically, what I wanted to bring up is why is tretinoin a prescription and the other ones aren't, if they're just going to turn into tretinoin once they're on your skin?
Yep.
And the answer is that we didn't really know that was going to happen until they were already out there and people were already using them.
Mm-hmm.
Just like the PDRN thing, maybe not just like that. I don't know exactly how it happened, but I do know that other retinoids were already commercially available.
Mm-hmm.
And once that cat's out, you can't put it back.
Guys, that's the thing about the cat that
That's
you gotta
the
understand.
thing. So yeah, we just wanted to kind of talk about that a little bit. And then mainly because I think its prescription status and its active percentage isn't always going to be indicative of how well it performs on your skin.
Mm-hmm.
The one benefit to these prescription products versus the cosmetic products are that prescription products have to show some level of consistency throughout the entire lifespan of the product, whereas the cosmetic ones don't.
Mm-hmm.
And so even though they may say a certain percentage is in there when it's formulated, that doesn't mean that's what's actively going to be delivered to your skin. If it's a prescription, that is a much more known concentration and dosage and all of that.
Yep.
You're not going to get a prescription retinoid in like a clear bottle, you know?
Yeah.
Like they know that those are options and all of those have to be really rigorously accounted for because it's a drug and you have to be able to assume it's going to perform consistently throughout the product's lifespan.
Yep.
Mostly.
Also, in theory, the cosmetics don't have to have, if they're advertising a percentage on the label, they should have that percentage like in the product.
Yeah.
But it's not regulated. So
yeah,
I don't think companies are doing that. I think if they say it's 0.25%, it's probably 0.25%.
Yes.
But maybe not over the whole course of its life.
Right. And we don't even know for sure if it's by the time you're opening the product.
Yeah.
Like it could be that even the way that they are mixing and filling the product, they're degrading it themselves.
Yeah.
You know, like there was some number, and I don't know exactly what it was, but there were tests done of market retinoids, and a pretty high percentage of them had lower active claims than what was advertised because of the degradation.
Yeah.
So that's not uncommon.
I don't think that companies are intentionally doing that.
No.
But I think that because retinol is so tricky to formulate with, I could definitely see a lot of products slipping through the cracks and not accounting for things that a prescription drug would have to account for.
Yes. And it is perfectly fine for a company to just throw retinol in an existing base and run with that.
Mm-hmm.
But like we mentioned with the benzoyl peroxide, those two things kind of degrade each other, cancel each other out. And so if you were to throw that into a formula, both would become inactive.
Yeah.
Most companies do have a incentive to make good products and efficacious products. So again, it's not going to be their intention to completely degrade their active that they are paying to put into the formula. But that doesn't mean that they are always fully privy to what's happening once it's in there.
Yep.
A lot of brands are probably throwing it in there thinking that it's totally fine.
Yeah. Yeah. It can definitely be difficult to know what products to use. But I do think that there are quite a few tips and tricks that you can sort of use. When I'm recommending retinoids, this is from someone who's not a dermatologist.
Yeah.
Keep that in mind this entire episode. This is just sort of what I have learned, tips and tricks. But again, like you should talk to your derm about this. So when you're choosing a retinol product, I would recommend starting off with a cosmetic, something that's on the market that is more gentle. An example that I want to use to kind of highlight this is Naturium's retinaldehyde cream serum. So a lot of products with retinol or retinol derivatives will have several different concentrations that you can choose from.
Mhm.
This one is a retinaldehyde cream serum, which like we talked about last week is a retinol ester.
Yes. So it's like the least potent.
Yep. So it's
step one of the evolution.
Yes, it's step one. And they have a 0.05, 0.1, and 0.15%. It's the gentlest form of a retinoid, but it also has 3 different strengths that you can choose from there. So if I were to recommend, if someone came to me and said, what should I start off with? I would say find a retinaldehyde or retinol ester derivative and start with the lowest potency that company offers. Try that out, see how your skin reacts, and then if you buy another bottle, you can increase the potency. If you felt like it didn't really do much at the very, like, let's say you start with this product and you start at the 0.05% and you were like, nah, my skin barely reacted. It was fine. You could skip a step and go up to like the 0.15. But I would start there and get your skin used to this ingredient being part of your routine.
Yeah.
And then also, like Nat said, I would always start with doing it every 3rd day. And another tip that you can do is we've talked about how humectants and water can kind of increase absorption. So when you're applying it, I would apply it to a completely dry face.
Yeah. If you have water on your skin, it's going to help it go into your cells.
Which for someone like me,
can be good if that's what you want. But
honestly, it is kind of crazy. My retinol application is right out of the shower. I dry off my face. I apply a glob probably this big of my tretinoin all over my face, and I'm totally fine. Like, I would not have been able to start off that way.
Yeah.
So when you're starting off, take it slow. Every 3rd day, make sure your skin is fully dry. You want to remove as many factors as you can.
Yeah.
And then make sure you have a really good moisturizer in your routine.
Yeah.
Set up your recovery days really well. And I probably wouldn't use a lot of other actives in your routine while you're introducing this.
Especially ones that can cause irritation.
Yes.
I mentioned this a little bit in the last episode, but people often recommend things like niacinamide, vitamin E. Both of those are more anti-inflammatory and can kind of help with calming your skin.
And I really do recommend humectants on a different night when you're not using retinol.
Yeah.
Because that can really help with hydration and skin barrier repair.
Yeah.
But just don't use it in combination. That doesn't mean that like if you have a moisturizer with humectants in it, like it's going to be really difficult to find a moisturizer that doesn't have those.
Yeah.
So I'll leave some recommendations. Maybe I'll do a little recommendation post on our Instagram page for kind of really good moisturizers and things that I found. But yeah, so step 1, retinaldehyde or some sort of retinol ester derivative, start at the lowest concentration and work your way up. Then once you feel like your skin is doing well with that, I feel like you could probably move on to an OTC. So there are 3 different types. There's cosmetic, like we've talked about. There's OTC, and then there's prescription. The only OTC that I'm aware of is adapalene or Differin gel. And that one comes at 0.1% concentration.
Adapalene started as a prescription.
Yes.
And then it was moved down into a topical format that was OTC. If you're doing straight retinoic acid, you have to get a prescription. Tretinoin is like the longest, most researched of all the retinoids, and it's retinoic acid. Tretinoin was kind of the starting one, and then adapalene was made in response to tretinoin. There are 3 different types of receptors that react with retinoic acid in your body. There's the alpha, beta, and gamma receptors, and tretinoin binds to all 3 of those. And at first, that sounds like it's a good thing because it would be more effective, but not all 3 of those have equal benefit. So binding to all 3 actually just causes more side effects and less direct benefit. So adapalene was made in response to that to try to solve the binding issue.
It also says it's a 3rd generation. What does that mean?
3rd generation just means that it was the 3rd one.
Okay, it has nothing to do with the type of...
No.
So they're both retinoic acid. It's the binding that changes it.
technically it's not retinoic acid, probably. It's a synthetic molecule that was probably made from a tretinoin of sorts, and they added some structural elements to try to get it to only bind with the one receptor that works well.
Okay, that makes sense.
But I think that they still bind to retinoic acid receptors. So I think that's kind of the difference. It's like your body makes retinoic acid, and then we've made drugs that still fit the receptor. Like, it's kind of the same thing with isotretinoin versus tretinoin.
Mm-hmm.
Both of them are the same.
Yeah.
One of them's just bent.
Right.
But like, technically, chemically, they are different because that bend does affect it in ways, but they still have the acid group on the end that's able to bind to the receptor.
Basically, differin is a less irritating version of tretinoin.
It's a more stable version.
Yeah, but I think less irritation is like part of why it's used.
Yeah.
Is because it's not binding with as many receptors, so it's just generally less irritating.
Yeah.
So that is pretty commonly known as like the gateway to using tretinoin.
Mm-hmm.
And so I would probably recommend, even if you wanted to skip the cosmetic ones completely and just go straight to differin, that's probably fine. But I would definitely try differin before you try tretinoin.
Yeah.
Unless your dermatologist says otherwise. But I think differin is a good way for you to get access to a stable, relatively non-irritating version of retinoids if you don't want to go straight to tretinoin.
Yeah. That is a very good place to start because, like we mentioned with the formulas, when you're just relying on the cosmetic grades, there's not as much proof that those are going to work for a long time. I personally don't really use a retinoid, and you just use tretinoin.
Yeah.
So neither of us really have great examples of retinoids that are cosmetic that we know have great data throughout their lifetime.
Yep.
So I don't know if either of us are really qualified to make a recommendation for a cosmetic retinoid, but I think it is definitely worth the trial and error if there is a brand that you like and or there's some product that people are giving good reviews or is, those products definitely work, and they can be a lot less irritating, which does mean that they can be a lot more sustainable. Like not everyone wants to feel like they are getting chemical peels every day.
Yes.
You know?
Yeah.
And some people just having a little bit of active ingredient present is all that they need to have like perfect skin.
Yeah.
And if they do more, they're going to get flaky red skin. And even if there's no acne or wrinkles, that's not necessarily what you want.
Yeah.
Like flaky red skin isn't like desirable.
No.
So
yeah. And I have tried different. I actually used it way before I started Accutane, and that did help me a lot. And I had very dry sensitive skin. So I do feel comfortable recommending that to people who have sensitive skin from my personal experience. But if you have really sensitive skin and you're a little bit hesitant to add in a retinoid, you can start with the cosmetic ones. I think they're fine. We'll post some that like we think probably are good. What?
Just looked at my screen. It's just the Walmart listing for Bush's baked beans.
Well, we were going to talk about that next.
Part of a balanced breakfast skillet, it would appear.
Yeah, if you're adding retinoids, you want to make sure you're eating well as well.
Eat a lot of baked beans.
Yes, it's good. The fiber is incredible.
I don't know how I got on here.
That's crazy, actually.
I just, in the middle of your train of thought, look down and see, I'm about to check out.
You have like a whole palette in your cart.
It's the sweet and savory, flavory. Right?
What is going on? Did you get a virus? Is that like a fake Walmart website?
Oh anyway, sorry, I derailed your thought.
No, you're fine. I feel like I'm comfortable being done.
Yeah. Just as like a reminder, if you're interested in retinoids, don't blame you. They're a really well-studied ingredient, and they can help with quite a few skin issues. I mentioned it last week. Just to round it out, dark spots, wrinkles, fine lines, uneven skin texture, acne, basically all the things that you ail from with your skin, retinoids can help with.
Yeah.
But if you have specific issues that you're trying to overcome, it's always best to go talk to a dermatologist about them. They're going to know the best course of action. Way better than we could ever know because it is so personal and so formula dependent.
Yeah.
Especially with retinoids, where they're always converting in and out of each other.
Yep. We have experience with cosmetic products. We are not skin experts by any means.
No.
That is not our wheelhouse. So definitely you can take this information, use it however you want, but ultimately definitely talk to a dermatologist about it.
Yeah. And if you're just trying to, if you don't have anything specific and you're just like, I want to have better skin, then definitely just take it slow.
Yes. Slow and steady is going to win this race.
It is.
Okay.
Which is why I haven't started. And it's okay to know yourself that way.
Oh, yeah.
It's growth.
Yeah. No, you don't.
You'll use a retinoid when you're older.
Yeah. You can use it whenever you're ready. Girl, that starting line is there for you whenever you decide to pass it.
Exactly.
Yeah.
But in the meantime, keep wearing sunscreen.
Oh, yeah.
Because retinoids, at the end of the day, they're just fixing all that sun damage that you have acquired over your lifetime. So the less damage there is to fix, the less likely you are to need retinoids to begin with.
Exactly.
So wear your sunscreen.
Drink your water.
Yeah.
Relax.
Yeah.
Low stress.
Exactly. All of those things can...
I'm not going to do that, but you should.
No. I don't have time.
No.
I have to get this episode out tomorrow.
Literally. It's not going to fit in my schedule.
But yeah, maybe I'll drink some water and relax.
While you're editing. Yeah, good idea. Yeah, well, thank you guys so much for tuning in for another episode of Beauty by the Beaker. We had so much fun making over science today.
We did. I hope you guys felt like there's noticeable improvement in the scientific appearance.
Yeah, hopefully. Hopefully it's hotter and smarter.
Yeah, I think it is.
If you do think so, please like, subscribe, leave a comment, share this episode with a friend.
Yes, let us know if you've tried any of these retinoids before, if you're interested in trying any of them, if you're interested in me trying one and letting you know how it goes.
Yeah, why don't you guys just bully Nat into starting Tret?
Yeah. Or something else. Maybe I could be the one to go on the cosmetic retinoid deep dives for you guys.
Maybe you should, because it's not a product category that I can even try out. Like, my skin is so...
You're like, your ship has sailed.
Yeah.
Your cat is out of the bag.
The cat has sailed. Okay?
The cat has its full piling license. Piling? Don't mess with that cat.
The cat is a pirate. I don't know where she is. Yeah. My skin is a little too used to prescription grades, so I don't think anything else will do anything. But you should definitely do some reviews.
Yeah. If you guys have a retinoid that you like, maybe let me know, because I am currently kind of looking for one. So if you have any recommendations, leave them below, not only for me, but maybe for other members of our community.
Exactly. Everyone can benefit.
Yeah.
Follow us on all of our social media accounts at BeautyXBeaker. You can visit our website, beautyxbeaker.com. And then you can follow me personally. I'm Sadie BXB.
And I am Nat BXB.
And we are tired, so we are going to go. But we will see you guys next week for another episode of Beauty by the Beaker.
We sure will. Bye.
There's always like an awkward pause before we're ready to say bye.